I'm David Kenigsberg. I'm a clinical cardiac electrophysiologist. Electrophysiologists are physicians that deal with heart rhythm disorders. The most common rhythm disorders that I deal with include bradycardia, which are rhythms that are too slow, and tachycardia, which are rhythms that are too fast. The treatment typically for many bradycardic patients, if they're symptomatic, meaning if they have dizziness or lightheadedness, shortness of breath with exertion, those patients are eligible usually for the implantation of a pacemaker, which is a small device that goes in the left chest. And then patients who have fast heart rhythms or tachycardic are eligible for what we call ablation, which is to go up into the body, thread a catheter into the heart, find the focus where the arrhythmia comes from, and zap it or burn it. The most common arrhythmia that we ablate is atrial fibrillation. About a quarter of the population as we age will have an episode of atrial fibrillation. The common question I get regarding atrial fibrillation are what are the different treatment options and how do I know if I have atrial fibrillation? So atrial fibrillation is an irregular rhythm that comes from the top chamber of the heart. The heart beats very quickly and the patient typically feels palpitations, although they can also feel shortness of breath, dizziness, lightheadedness, passing out, sometimes chest pain or chest pressure. The symptoms can come on sporadically and without cause, so the patient could be lying in bed and notice that their symptoms arise. And in those patients, the goal is twofold. One is to reduce the risk of stroke, and the other one is to reduce the symptomatology. So stroke risk is dealt with either by blood thinners or by the implantation of a device inside the heart called the left atrial appendage occlusion device. There are actually two now available in the market. There's Watchman, which is FDA approved, and we've been implanting since last year, and the Amulet device, which is just recently under study that we're also implanting. For the treatment of symptoms, we typically offer antiarrhythmia medications, and many times when patients get referred to me, we offer them what's called ablation. Ablation is when I go up into the heart, find the arrhythmia focus, and either burn or freeze that focus. If someone is early on with the disease process of atrial fibrillation, we use what's called cryothermal energy or a freezing balloon. That's the newer way of doing things. And then if someone has had atrial fibrillation for a long period of time, or they've undergone more than one procedure for atrial fibrillation in the past, we sometimes offer burning or radio frequency energy, similar to microwave. All of these therapies that I've talked about, as far as pacemakers or ablation, are available at Westside Regional Medical Center, where I work as the director of the electrophysiology lab. In addition, as an electrophysiologist, I implant devices called defibrillators. Those are put in patients with weakened heart muscles, congestive heart failure, and cardiomyopathy. And those are put in to prevent people from having deadly, dangerous heart rhythms in the bottom chamber of the heart. Some people have a weak heart muscle and don't know it, and I highly recommend that patients go out there and ask their other physicians what their ejection fraction is. And I'm a big proponent of the Know Your EF. EF is ejection fraction campaign. Which means that patients will go and ask their physicians, what is my EF? And if your EF is 40% or less, we should be talking to a cardiologist or an electrophysiologist about are they candidates for a defibrillator. Defibrillators are pacemakers that check the heart rhythms for dangerous heart rhythms and either pace or shock the heart out of those rhythms to save people's lives. So as an electrophysiologist, I put in devices, I do ablations, and I'd be happy to take care of you or your family member if you have any problems with your heart rhythm. Thank you very much for listening and have a good day.